Hi, good morning. I just came from walking outside and saw varieties of foods like fishball, halo-halo, pancit, and so on. However, some of the stalls are located near the road where different vehicles pass by from time to time. And some of the foods are not well covered and handled. What do you think might happen if these foods entered the mouth and digested by the stomach? Will there be adverse effects? Come on, join me as I continue the discussion about the microbial diseases of the digestive system. Now, let's begin with some of the bacterial diseases of the lower digestive system. So, cholera is one of the most serious gastrointestinal diseases caused by Vibrio cholerae. So, strains of Vibrio cholerae like O1 and 139 produce an exotoxin that alters the membrane permeability. So, when we say O in the name of the bacterial strains, O pertains to the cell wall antigen. So the incubation period is approximately 3 days. Symptoms like vomiting and diarrhea last a few days. And untreated cholera has a 50% mortality rate. Therefore, when one suffers from too much vomiting and diarrhea, one must immediately consult a physician for further examination. So diagnosis is based on the isolation of Vibrio from feces. And for treatment, fluid and electrolyte replacement is provided. So next, non-cholera Vibrios. So ingestion of other Vibrio cholerae serotypes can result in mild diarrhea. So Vibrio gastroenteritis can be caused by Vibrio parahemolyticus and Vibrio vulnificus, which are both found on saltwater estuaries. So the onset of symptoms begin within 24 hours after eating contaminating foods. So particularly, the disease is contracted by eating contaminated crustaceans or contaminated mollusks. That is why whenever we eat seafoods, especially crustaceans and mollusks, we should assure that it has been cooked very well to avoid contamination that can lead to various diseases. So next is Escherichia coli gastroenteritis. So Escherichia coli gastroenteritis can be caused by enterotoxigenic, enteroinvasive, or enterohemorrhagic strains of E. coli. So the disease occurs as epidemic diarrhea in nurseries, as traveler's diarrhea, as endemic diarrhea in less developed countries, and as hemorrhagic colitis. So enterohemorrhagic E. coli, such as E. coli O157H7. So later I said that O pertains to cell antigen and H pertains to flagellar antigen. So this strain of E. coli produces Shiga toxins that cause inflammation and bleeding of the colon, including hemorrhagic colitis. Also, Shiga toxin can affect the kidneys to cause hemolytic uremic syndrome. So next, Campylobacter gastroenteritis. So it is caused by Campylobacter jejuni. And Campylobacter is considered as the second most common cause of diarrhea in the United States. So it is transmitted in cow's milk. That is why we should be careful on choosing cow's milk for our families. So next, Helicobacter peptic ulcer disease. So it is caused by Helicobacter pylori, which produces ammonia and which neutralizes stomach acid. So the bacteria colonize the stomach mucosa and cause peptic ulcer diseases. So the utilization of bismuth and several antibiotics may be useful in treating peptic ulcer diseases. Next, Yersinia gastroenteritis or yersiniosis is caused by Yersinia enterocolitica and Yersinia pseudotuberculosis, which are transmitted in meat and milk. So symptoms are diarrhea, fever, headache, and abdominal pain. So these symptoms are sometimes misdiagnosed as symptoms of appendicitis. That is why diagnosis is usually based on isolation and identification of the pathogen from stool samples. Also, Yersinia can grow at refrigerator temperature. So next, Clostridium perfringens gastroenteritis. So the causative agent is Clostridium perfringens, which is an endospore-forming bacteria. So endospores survive heating and germinate when foods, usually meats, are stored at room temperature. So exotoxin produced when the bacteria grow in the intestines is responsible for the symptom. And again, diagnosis is based on isolation and identification of the bacteria from the stool sample. So next is Bacillus cereus gastroenteritis. So the causative agent is Bacillus cereus. So it is one of the more common cause of food poisoning. And we know that some foods when heated are not killed, the spores are not killed by heat. So when it cools, the spores germinate and it reproduces. That is why ingesting food contaminated with the soil saprophyte Bacillus cereus can result in diarrhea, nausea, and vomiting. So that's it. Now that we're done with the bacterial diseases of the lower digestive system, let's now move on to the viral diseases of the digestive system. So mumps. Mumps virus enters and exits the body through the respiratory tract. So about 16 to 18 days after exposure, the virus causes inflammation of the parotid glands, fever, and pain during swallowing. And after 4 to 7 days later, pruritus may occur. So diagnosis is based on symptoms or an ELISA test, or enzyme-linked immunosorbent assay test is performed on viruses cultured in embryonated eggs or cell culture. So next is hepatitis. So hepatitis is classified into 5. Hepatitis A, B, C, D, and E. So they are classified according to their mode of transmission, their causative agent, and if they cause chronic liver disease. So first, hepatitis A. The transmission is fecal-oral, and the causative agent is picornaviridae. So it does not cause chronic liver disease. Next is hepatitis B. So the transmission is parenteral and through STD or sexually transmitted disease. The causative agent is hepadnaviridae, and yes, it causes chronic liver disease. So next is hepatitis C. The transmission is also parenteral, and the causative agent is filoviridae. So it also causes chronic liver disease. Next is hepatitis D, and the mode of transmission is parenteral and hepatitis B virus co-infection. So the causative agent is deltaviridae, and again, it causes chronic liver disease. And last is hepatitis E, and the transmission is also fecal-oral. So its causative agent is calciviridae, and it does not cause chronic liver disease. And last, viral gastroenteritis. So viral gastroenteritis is most often caused by a rotavirus or the human calcivirus, better known as the Norwalk or norovirus family of viruses. So the incubation period is 2 to 3 days, wherein diarrhea may last up to 1 week. So treatment is oral rehydration or in some cases intravenous rehydration. So that's it. That concludes my report. But before I end this video, I just want to say that eating foods, enticing foods that we see or crave for is not a bad thing. What we just have to remember is that prevention is better than cure, which means we should be wise in choosing what to eat, where to eat, when to eat, to avoid whatever diseases that we might acquire. Also, we should use our mind first for deciding before following and satisfying the sound of our hungry stomach. So that's all. Thank you for watching. Have a nice day and a happy meal.